I've just mentioned a few of the results that Unitaid's investment have achieved over the past few years. Of course, if you look at the broader perspective, the combined achievements and results by all partners in the medical oxygen space, including the partners that were part of the emergency task force, those numbers are even higher. I'm proud to say that we did make significant progress over the past few years. But unfortunately, the remaining gaps are even more significant. Still today, only about half of all health facilities in low and middle income countries have uninterrupted access to medical oxygen. And those shortages, as you can imagine, still have deadly consequences, especially for the most vulnerable. So every year, about 25 million deaths are linked to conditions that could be treated if medical oxygen were available. And to give you just one example, there are about 7 to 8 million children with pneumonia that require oxygen therapy every year. But only 1 in 5 of those children has access to medical oxygen and can get the oxygen therapy that they require. So it comes back to that terrible decision that Leith mentioned, where doctors really have to decide which kid, which child receives the oxygen and can continue to live and which doesn't. So it's clear that building and strengthening oxygen systems, especially in low and middle income countries, has a huge potential in terms of the impact, the lives saved. So we could cut hospital deaths in children under 5 by at least 25%, hospital deaths in children with pneumonia by 50%. So this shows you that the world really cannot afford to continue underinvesting in the essential medicine that medical oxygen is. And we really need to work together, as Leith already mentioned as well, the governments, industry, global health partners, to address those chronic shortages of oxygen. Because there is no alternative. If you suffer from hypoxemia, there is no alternative to medical oxygen. And without medical oxygen, we cannot achieve the Sustainable Development Goals. We cannot ensure primary health care, universal health coverage, maternal and newborn health. All that wouldn't exist without medical oxygen. But now your question was, what exactly needs to be done to ensure that low and middle income countries are better prepared? Well, we at Unitaid are convinced that we need to take a holistic approach there for building oxygen systems that are really adapted to low resource settings, that take into account the conditions in low and middle income countries and that work in these conditions, which means that we need to introduce innovations, for example, higher quality or more affordable oxygen delivery systems. We need to build the national and regional manufacturing capacity for oxygen. We need to shape and build healthy markets, competitive markets, for example, by working with existing suppliers and manufacturers, negotiating agreements to lower prices, but also support emerging suppliers so that they can meet the quality standard, the international quality standards that have been established by WHO. Finally, we need to make sure that we support governments and countries and health facilities so that they can determine which oxygen systems, which methods, which delivery systems, which supplies work in the specific conditions that they're facing on the ground. And I think this is the uniqueness in Unitaid's approach, that we really address this access component across every step of the value chain. So we need to keep promoting innovations, to keep shaping markets in order to prepare those low and middle income countries for any future threats or emergencies that they may face in the future.